Hello, everyone. The resident doctors have said they are going to go on an indefinite strike come November 1st, 2025. And of course, they have been given warnings that they're going to go on strike for quite a while now. But as it is, government never listens until when they go on to do what it is that they want to do, which is a strike. And then we start all the running helter-skelter trying to get the situation brought under. But I mean, I'm just sitting down here and I'm just like this with all of these things because I find it so somehow irritating all the time. You have these trade organizations, you have these professional bodies who should be at the forefront of fighting for a better Nigeria, but they never do that. They only come on this their strike when it has something to do with their salaries and all of that. What they do not realize is that these salaries you're talking about, the reason why they are this way is because of bad governance. And when there's always call for Nigerians to come out, and fight bad governance, usually they're nowhere to be found. You find professional bodies, trade unions, student unions, all of this collectively have failed Nigeria as a country. But let's dive right in and see what Sahara Reporters has got to say, has reported on this matter. It says NARD, and so that's the Nigeria Resident Doctors President, Dr. Mohammed Suleiman, disclosed on Saturday that the decision was reached after the association's National Executive Council NEC reviewed the government's response to their demands during an emergency virtual meeting. The Nigerian Association of Resident Doctors, ANARD, has announced plans to commence on indefinite nationwide strike starting November 1st, 2025, following the expiration of a 30-day ultimatum earlier issued to the Nigerian government. Because I did say there's been warnings that they've been giving. So they gave a 30-day ultimatum that this was going to happen. And what a responsible government should do would be to engage them and ensure that the strike does not end up happening. Because when you have strikes like this happening, it really does affect a lot of people. There are people who ordinarily are able to afford private care, private hospitals, they will go up there. But there are so many other people who cannot afford those private care, private hospitals. And so with the public hospitals, the moment there are strikes, it then affects them. There definitely are going to be lives that are going to be lost. There are people whose condition will end up worsening than they would have if there were no strike. So these are very critical areas. But then at the same time also, the resident doctors have complained a lot. They have really genuine reasons why they should be going on strike, and the fact that they are not being treated as well as they should be treated. NARD President Dr. Mohammed Suleiman disclosed on Saturday that the decision was reached after the association's National Executive Council reviewed the government's response to their demands during an emergency virtual meeting. The neck of NARD has declared total and indefinite strike action starting November 1st of 2025. As a matter of fact, the NEC said all the 19 points are our minimum demand and there is no going back. The notice for the strike will be out maybe later today or tomorrow, Suleiman explained. So they're giving that grace to say we're going to go on strike on November 1st, and we have our demands. These are 19 points, 1, 2, 3, 4, 5, up to 19 points demands that we have, and they are all barest minimum. So it's something that for them, they're not going back on this. Punch reports that the strike, once it begins, is expected to paralyze medical services in hospitals nationwide, as resident doctors constitute the backbone of clinical care in Nigeria's healthcare system. For such people that constitute the backbone of clinical care in Nigeria's healthcare system, it's quite, sad, and it's frustrating seeing how they're being treated. They are not being treated as truly they are the backbone of the Nigerian medical healthcare services. And so it's frustrating for them. And a lot of times you see them complaining, even on social media, you see them complaining about the residency. And there are also a lot of doctors that are no longer into that residency. They're no longer doing that. They're just looking for way. The moment they graduate, they find their way abroad or choose other places. And even beyond that, also is the fact that to get the residency is such a Herculean task. People, you see them, they are even having to bribe, do all sorts for them to be able to get it. And then when they get it, the reward that comes with it is not commensurate with the hard work that comes with it. Punch reports that the strike, once it begins, is expected to paralyze medical services in hospitals nationwide, as resident doctors constitute backbone of clinical care in Nigeria's healthcare system. NAD had on September 26 given the federal government 1 month to address lingering issues affecting the welfare and training of resident doctors and medical officers across the country. Among the grievances listed by the association are excessive and unregulated work hours. And honestly, they really have every right, to protest this. We saw recently, I think about a few months ago, where a resident doctor died on duty. This resident doctor had said or told his boss that he wasn't feeling fine, and yet they insisted that he had to come and work. And he did, was it in a 36-hour shift, or is it 48 hours, 72 hours shift, something like that? That is, you're on call for 72 hours straight, or I don't know whether that's it, or you're on call at night for those things. But the guy died while he was on this thing. And it really led to a lot of anger. And there were many people who are talking about this inhumane, hours, ungodly hours that people are being forced to work. Why do you put people through so much? Another thing they complain of is non-payment of outstanding arrears from the 25 and 35% upward review of the consolidated medical salary structure, and the unjust dismissal of 5 resident doctors from the Federal Teaching Hospital, Lokoja. And you always find this when people speak up or something, then they are now being punished with dismissals and all of that. The association also expressed frustration over non-payment of promotion arrears to medical officers in various federal tertiary hospitals, as well as the failure of government to pay the 2024 accoutrement allowance despite repeated assurances from the Ministry of Health. With all of these things, people, you're not able to do this, but you're spending money buying vehicles, buying cars, buying all of that. We are seeing Tinubu is budgeting billions to buy cars for the office of the First Lady. That is not even constitutional. Yet you are owing doctors who hold all the who are the backbone of the Nigerian medical healthcare system. You're owing them. You're not treating them the way they should be treated. NAD further cited bureaucratic delays in upgrading resident doctors' rank following the completion of postgraduate medical examination, leading to non-payment of new salary scales and accumulated arrears. The doctors also condemned their exclusion from the specialist allowance despite their critical role in providing specialist level care to patients across the country. Similarly, the association faulted the exclusion of medical and dental house officers from the civil service scheme, a policy it says denies them rightful salaries, professional recognition, and career progression. NAD also decried the downgrading of newly employed resident doctors for CONMES 3-step 3 to CONMES 2-step 2, resulting in reduced earnings, unpaid salary arrears in several federal hospitals. And I think these are quite legitimate reasons for them to, want to go on this indefinite strike. And it's left for the government to be responsible government, and the government with empathy and think about its people and ensure all of these things are resolved so that there will not be protests that we know definitely will be leading to loss of lives. Thank you so much for watching.